So I had a patient come to see me yesterday and they were slightly annoyed with me when they arrived. And it was because they'd seen me a few days before in the supermarket and I hadn't acknowledged them. In fact, I'd completely and utterly blanked them as if I never knew who they were. And they were really annoyed because they wanted me to go, hey, how you doing? How are you? How's things going? How are you getting on from your treatment? They wanted me to acknowledge them and I completely and utterly ignored them. And before you all get head up, no, it's not because of my autism. Yes, I did recognise that person, but I did not acknowledge them in any shape or form. And I bet you're thinking, well, that's just rude. Actually, it's because legally I can't. For me to acknowledge a patient outside of the clinics breaks patient confidentiality, which I take very, very seriously. You may not have told the person you're with that you've even had acupuncture. So if I suddenly come up to you and go, hey, how are you doing? How are you? How's your treatment going? How are you getting on? You're going to have to give me information there and then in front of other people, complete strangers or your family and friends that may not know that you've been to see me. And when I then leave, they're going to say, well, who's that? Which means, again, you're going to have to tell people maybe how you know me and things like that. And it puts you in an awkward position. And in some cases, when you've got people coming to you with trauma from domestic abuse, you may not want your partner to know that you've seen an acupuncturist. It becomes a nightmare. So one of the rules that was told us at university, and it was a big one, was that we do not acknowledge patients outside of the clinic first. It just solves that whole problem. Outside of this clinic, if you are a patient and you would like me to acknowledge you outside of this clinic, you have to engage me. Hi, how are you? I can then respond, I'm good, thank you. Are you okay? But again, I will not discuss your case outside of this clinic. It will be kept on the surface. Hey, how are you? Hope you're having a good day. Hope you've been well. I won't discuss your treatment. I will not discuss how you're getting on in that way because, again, patient confidentiality, you don't know who's listening. That's your personal details and I don't want to give it out there. Even though you want to discuss it with me, I would rather discuss it here in privacy in the clinic. So please do not think I'm rude if I'm outside and I don't acknowledge you. You just need to drop me a hey and I can then go, hi, how are you? I hope you're okay. But I will keep it on the surface. I'm not rude, honestly. Well, not intentionally, maybe. This has been Thoughts with Points. Hope it helps. Take care.